Okay, am I audible to you guys? Can someone let me know if you guys can hear me? Okay, am I audible to you guys? If someone can tell me whether you guys can hear me, then we can get started. Alright, so I guess everyone can see the screen and can hear me. So we are going to get started with the first question. So I thought we'll discuss today the upper limb section, and then we'll do thorax a different day. So we can get started with the first question, and you guys can, if you guys have any questions regarding the things that I'm discussing with you today, just drop down the questions in the comment section and I'll answer them as we go on. Okay, so now the first question, I know it's not very legible, but it's about a patient that's presented to the surgical ward with dislocation of the right shoulder joint. And then the question is not very visible. So this is a very it's a very common question that you guys are going to be having for your second MB exam, and it's been coming almost every single year. Whether it's coming to supplementary or to the proper paper, it's a question that you'll have to answer at some point. Okay, so let's see what the question entails. So what is the nerve which has been affected? Now, the usual, let's say that for this presentation, the patient had inferior dislocation. So if it's an inferior dislocation, the nerve that usually gets involved is the axillary nerve. Okay, and there are usually two structures that are affected by the axillary nerve. So can anyone recall what these two structures could be that are affected by the axillary nerve? So it's usually two muscles. Those are the deltoid muscle and the teres minor muscle. Okay, so and I know it says here three structures, but usually they could what I think they mean here by three structures is also that it supplies the skin, what we call the deltoid regimen patch. So there will be the third structure they could innovate, but usually the question that gets asked is about muscles. So the deltoid and the teres minor are the muscles that are usually innervated by the axillary nerve. So you can see now that they give 15 marks for this question. So obviously you can understand where the marks, how the marks are allocated. So there are three structures, so that means 5 marks for each answer that you give. When you're answering SEQs, make sure that you're always to the point. Now I know that maybe sometimes when you guys don't know how to answer questions, what you tend to do is to give really long answers and try to give as much as you can, hoping that you guys will get some marks for what you're saying. But usually what they do here is, if they're saying name 3 structures, they'll always be looking at the first 3 structures, the first 3 answers that you have written. So obviously they're expecting 3 words. So if you write 3, let's say that you write 5 words, 5 different structures, they will only be looking at the first 3, and they won't even look at the last 2 structures. Okay, so make sure that you always write in the correct ones that you think are correct. They should always be the first 3 in this case. So if you want to go ahead hoping to get some more marks in case the other ones, the first 3 that you written are incorrect, you can write the other ones later. Okay, now the next question is name the rotator cuff muscles. So we know that there are 4 rotator cuff muscles. So what are those 4 rotator cuff muscles? Can anyone mention them in the chat? Okay, so we have 4. So those are the supraspinatus, the subscapularis, the infraspinatus, and the teres minor muscle. Okay, so they're expecting here 4 answers. So those are the ones that you're supposed to give. And then discuss the nerve supply of the rotator cuff muscles. Now, if you take the supraspinatus is innervated by the suprascapular nerve. The infraspinatus, again, suprascapular nerve. Teres minor comes from the axillary nerve, as we said, and you can be a little bit more specific here and say even that it comes from the posterior branch of the axillary nerve, because the anterior branch is the one that supplies the skin over the regimen patch. Okay, so the posterior one is the branch that is considered the muscular branch that will supply the muscles, and anterior is the sensory supply to the skin. And then yeah, that's it. And then the subscapularis muscle, which didn't mention, so it comes from the upper and lower subscapular nerves, coming directly from the posterior cord of the brachial plexus. Okay, so that's how you answer the first 4 questions. Now let's have a look at the last question, which is the one that carries the most amount of marks, and it's about the stability of the shoulder joint. Now, if you might recall this question from one of Lalance's tutorials, because he's the one that usually teaches this section. Now, when you're answering this question, you have to start from the bones itself. Okay, so you have to talk about bones, you have to talk about ligaments, the capsule, and the muscles, and the accessory features. So when we talk about bones, we are looking at 2 bones. We are looking at the humerus and the scapula. Now, what are the 2 sections that come into contact and form the shoulder joint? Is the head of the humerus and the glenoid fossa of the scapula. So you have to mention that the first point of stability of the shoulder joint comes from the contact of these 2 structures. But it's very limited due to the shape of the 2 bones. And obviously to keep them attached, you need additional structures. So that's where we include the ligaments, and you can name here all the ligaments that are involved in the attachment of the shoulder joint. So you can start with the glenohumeral ligaments. So let's take actually a picture of the shoulder joint to help us out. Okay, so we can have a look at this one. So you can see the glenohumeral ligaments, and usually there are 3 bands, so you have to mention all 3 bands, starting from the superior, the middle, and the inferior band. And then you can mention about the coracohumeral humeral ligament going from the coracoid process to the humerus, and the coracoacromial ligament, which prevents the hyperextension of the shoulder joint, okay, which basically goes from the acromion to the coracoid process. And then the transverse humeral ligament, which is not written here, which usually goes from the greater tubercle to the lesser tubercle, in order to keep one of the accessory features of the shoulder joint, which is the the tendon of the long head of the biceps brachii. Okay, so those ligaments need to be mentioned. And then what you would want to talk about is the capsule itself, and you have to mention that the capsule is lax, which basically means that allows movements and allow flexibility, but at the same time is quite strong. Okay, and then you have to talk about the rotator cuff muscles. So we have 4 rotator cuff muscles, so you can name them there because you already named the 2.3, so you can quickly mention that there are 4 rotator cuff muscles, and these are the ones that you're going to be involved with. And then finally you can talk about the accessory features, which is the glenoid labrum and the tendon of the long head of the biceps brachii. So you have to mention how those help. So the glenoid labrum helps to deepen the glenoid fossa. So by deepening, so it means that the head of the humerus is able to attach properly to the shoulder joint and to the glenoid cavity of the scapula. And the tendon of the long head of the biceps brachii, we know that it starts from the supraglenoid tubercle. Right, so you can mention that it's attached to the scapula, and since it goes between the greater tubercle and the lesser tubercle, it provides more stability. Okay, so that's what this question is asking for. Okay, sometimes they don't divide the questions like this. They don't say name the rotator cuff muscles and the nerve supply. This could all be one single question. The 2.3 discuss the stability of the shoulder joint. That could be the only question given. So these two could fall within the same question. So you'll have to write all the names of the muscles that you're involved with and the nerve supply for those muscles. Okay, so all of those will be included within the 40 marks. But in this question, they've been a little bit nicer. I suppose this is coming from a supplementary paper rather than a proper paper. If it's a proper, this is the only question that you would usually get. Okay, so sometimes what you can also do in here, you can talk about the insertion and the origin of these muscles as well. Like the subscapularis, you can mention it comes from the subscapular fossa and it inserts into the lesser tubercle of the humerus. Likewise, you can talk about the origin insertion of all the other muscles. They'll be expecting that. Every time you're talking about the muscle, origin, insertion, innervation should be mentioned for you to gain full marks on that question, on that section. Alright. Okay, so like I said, if you guys have any question, feel free to drop them in the comment section. I'll answer them. So we'll move on now to the next question. So the next question is about the axilla. Okay, so this doesn't usually get asked, but it's again a possibility within the upper limb section of questions. Now when it comes to the axilla, you have to talk about the walls. Okay, so when they talk about the boundaries, the walls are the ones that you need to mention. So we know that there is an anterior wall, there is a posterior wall, medial, lateral, and there is also an apex. Okay, so they want you just to name them. So you can say the anterior wall is made by 2 layers, so the pectoralis major and minor. The posterior wall is made by the subscapularis, teres major and latissimus dorsi. The medial wall is made by the first upper 4 intercostal spaces. And the lateral wall is the medial aspect of the upper part of the arm. Okay. And then the apex is usually the gap between the middle third of the clavicle and the outer edge of the rib. So in this case, because it just says name the boundaries, all you have to say is that there is yeah, you can just say the way I just mentioned, anterior wall is made by these muscles, just to make sure. Otherwise, I think, yeah, I would say that's the best way to answer that question, because you can't just say anterior wall, posterior wall, so you have to mention the muscles involved there. Now, in this sort of question, I wouldn't go and mention obviously origin, attachments, insertion, based on the fact that it only has 15 marks. If this was like a 40-50 mark question, then I would go and explain more about origin, insertion, innervation of those muscles as well. Okay, so looking at the amount of marks is very important, and make sure that when you're answering this question, you're timing your answer. So a question like this, the entire full question should take you only 30 minutes. Okay, so there are six questions, so that means you have half an hour per question if you want to finish within the 3 hours. Okay, so if you're going a little bit beyond that, it means you have to speed up on your answer, or you come back later to finish that question and you move on to the next question. Now, describe the parts, sections of the axillary artery, and name the branches arising from each part. So when I always tell you guys, when you're answering this question about the axillary artery, whether it's a viva or an SEQ, the order of the axillary artery is very important. So now we know that there are 3 parts to the axillary artery. Let's have a quick look over here, this picture, so you can see it. Yeah, so looking at one of the questions, half an hour per question for the second and B. All right, so it's if I remember correctly, it's 3 hours. So you guys have 6 questions, so that's half an hour per question. Okay, so okay, so we'll go ahead with this diagram. So you can see that there are 3 parts. Okay, so you can mention the 3 parts as I think I have a better diagram for this. Okay, so I have it here. So you can either mention the first part, second part, or the third part, or you can use the name that's been given to each part, which is the suprapectoral part, retropectoral, and infrapectoral part. Now the suprapectoral part originates from the subclavian artery, and it crosses the lateral margin of the first rib. So you can see here the subclavian artery, and it starts just underneath the inferior margin of the first rib. So where does it go? It goes all the way until it reaches the pectoralis minor. So once it goes behind the pectoralis minor, so from here to here, it's what we call the retropectoral part. And then the infrapectoral part, is the one that is located between the inferior margin of the pectoralis minor and the inferior part of the teres minor and latissimus dorsi. Okay, so those is basically what they're expecting you to say for the first part of the question. Describe the parts, and remember, when they say describe, it means that you have to do a diagram. You can't just write everything down. You also need to make sure that you're drawing a diagram. So they'll expect you to draw something like this. You're drawing the artery connected to the subclavian artery, and then each part should be allocated like this: part 1, part 2, part 3, and the branches they come from each part. Should we include a diagram when they ask to describe? Yes. Okay, every time it says describe, they will allocate certain marks for a diagram. You might have written everything for that question. If you don't have a diagram written there, you're not going to get the full marks on that question. So if it's out of 100 for the question. Even if you include everything, you might get maybe 70, 80. The other 20 marks come from a diagram. And let's say that you don't remember everything for that question. So in this question regarding the axillary artery, the branches, you don't remember everything. If you draw the diagram, there are certain marks that you'll get from the diagram itself. Okay, so if you just want to pass, someone looking for a distinction to get the full marks on that question, make sure the diagrams are there, whether they're complete or not. Certain marks will always be allocated for those diagrams and will help you to pass the exam. It's a difference between a fail or a pass for some students. Okay, so make sure that for your final exam, you always go through all the diagrams and you know how to draw them. And you'll see once you do your SEQ papers, there are certain questions that will always get repeated. So you'll have to know how to draw those diagrams. Now something like this, like the axillary artery, is not always asked. I've only seen it a couple of times, so it's something that's not asked as often. So if you remember it, you remember it. Otherwise, it's something that a lot of people usually miss on. Could you show an example picture? Yeah, so this is essentially what you should be able to draw. Okay, you don't need to color it or anything. Whether you use a black pen or a blue pen, that's more than enough. But make sure that it's neatly drawn with all the names of the branches. That's important. A rough diagram is enough, no? Or should we be specific about the direction of the arteries as well? Rough diagram is enough. Okay, this is the final exam. You're under pressure. You have only half an hour to answer this question. They are not expecting you guys to do a wonderful job, great recreation of what you see here in this diagram. Okay, but as long as the branches are there and you show them clearly that, let's say that the superior thoracic artery comes from the first branch and it's clearly evident in a picture, that is enough for you to get the marks on that question. Okay, right. So those are the parts. And then the branch is the axillary artery. So it has to be in this order. No any other order will be accepted. This is the particular order you have to use. Superior thoracic artery, which comes from the first part. So here we have your superior thoracic artery. This is the thoracoacromial artery, which has 4 branches. So make sure that all the branches are there. So you can see the branches here, going to the acromion, going to the pectoral muscles, the clavicle, and the deltoid. Okay, so all those branches need to be shown and annotated. Then we have the lateral thoracic artery, the subscapular artery, and the subscapular artery is here. You can see it's coming down from the 3rd section and it's dividing into the circumflex scapular artery and the thoracodorsal artery that supplies the latissimus dorsi muscle. And then finally we have the anterior circumflex and the posterior circumflex humeral arteries. Okay, so that's how you answer this question. That's, if you know it, it's an easy 25 marks to get. Okay, and you can be 100% sure that you're going to get that full 25 marks if the diagram is there and you have all the branches and the parts written. Okay, so draw the formation of the brachial plexus and its branches. So this is again it's almost a gift question, this one. Okay, if you get something like this, draw the brachial plexus and its branches. Again, it's very easy, 30 marks. So let's see if I can find a easy brachial plexus for you guys to use as a reference. Okay, so something like this is what they're expecting to see on the day. Okay, this is the essentially the frame of the brachial plexus. You can see the roots, the trunks, division, cords, branches. So they're essentially expecting this same drawing in your exam. You need to be able to, so if you can divide these sections by using some dotted lines, vertical dotted lines going down, that's a much better way to show the brachial plexus. Okay, and then from here you'll have to put all the branches, like long thoracic nerve coming from C5, C6, C7, the dorsoscapular artery, and so on. So all the branches need to be annotated. Let's see if there is one with, okay, so all the branches that you're seeing here need to be there. Dorsoscapular nerve, the long thoracic nerve, suprascapular, subclavian nerve. Okay, so like that, they need to be annotated and divided like this with the dotted lines. And each branch needs to be annotated, so don't forget to annotate the diagrams. That's very important. Okay, so I don't think there is much to discuss there. As long as you know how to draw the brachial plexus and the branches, you can easily get that 30 marks again. Okay, so remember to take some colors with you. Okay, some colored pens, not just black or blue. Maybe have, I don't know, different colors, purple, pink, something that you can use to draw your diagrams. So that's something that could help to make your diagrams more visible to the examiner. Okay, sometimes if everything is in black or in blue, it becomes a little bit difficult to follow your diagrams. So if you can use different colors, it will help. Right, so the next question, which part of the brachial plexus is injured in Erb's palsy? Now when we talk about Erb's palsy, which part of the brachial plexus are we talking about? So that's essentially the same as Erb-Duchenne paralysis, right? So essentially the brachial plexus injury happens at C5, C6 level. So if we take the brachial plexus again, so we have C5 and C6. So how many colors do you recommend? I would say have like 4 or 5 colors just to make sure. Okay, have a black pen, blue pen, and then 3 different colors that you can use. A red pen, and then 2 different colors, a green pen and purple pen, for instance. Okay, so you can make all your annotations with one color. Let's say all the names, like in this case, if brachial plexus, cause, division, trunks, roots, maybe let's say in green, and then the diagram is done in black, the backbone of the brachial plexus, and then the branches are done in a different color, let's say red, and the annotations then are done on with a different color. Okay, so it kind of helps the examiner, since they'll be reading so many answers over and over again, to have something like that will help them to see your pictures clearly, and they'll end up giving you more marks because they are able to see everything in detail. Yeah, that's a much better way for you to gain all the marks. Okay, now I forgot what we were discussing. We were talking about Erb's palsy, right? Okay, so C5 and C6, this is usually the part where the damage will be found. And the question is asking which part of the brachial plexus. It's just 10 marks. So if you say that the C5 and C6 roots are affected in Erb's palsy, you'll get that 10 marks. Now list 4 clinical features that you'll find in Erb's palsy. So okay, so you'll get weakness of the arm. There'll be, let me just quickly have a look at this one. Okay, yeah, so you'll have muscle weakness, so that will lead to weakness of the arm. There will be numbness because there's sensory loss of sensory supply to the skin. There could be complete or incomplete paralysis of the arm. and there will also be loss of range of motion. So because you because you can't use the muscles, so then that will lead to loss of range of motion. Okay, so we have weakness, numbness, loss of range of motion, and also paralysis. Okay, so you're just supposed to list those 4 clinical features. Again, each question will be worth 5 marks. Okay, so that's how you reach your 20 marks overall. So sometimes in anatomy, when it comes to this point, it's not just memorization like in the CAT exams. You'll have to use a little bit of your common sense as well when it comes to answering the questions. And if you want to score and pass the second MBA exam for anatomy, you have to do all of these SEQs. So I don't know when you guys are doing your second MB, but if you guys can let me know when you guys are doing your second MB, then I can get an idea when you should be starting. But at least usually before your study leave, you should have completed these questions. I'm not expecting you guys to remember the answers or anything, but you should take your time now, answer these questions. I don't know, you can use ChatGPT, or you can, form groups and discuss these questions among yourselves and find answers. Write the answers down, and then you can completely forget about these questions. And then during the study leave, you can go back to these questions and have a look at the answers, which you already answered, so you're not going to be wasting any time looking for answers. You can just quickly scroll through all the questions and the answers that you've written and just by heart them. Okay, so that's September 9th. Okay, so you have still a little bit of time. So if you haven't done that already, it's okay, just start now. But what I would say is, if each one of you you guys can help each other. Like one person can answer one paper, the other person can answer the next one. So there are now more than 10 intakes of papers, or proper papers and supplementary papers that you guys can do. So you can divide the workload among yourself and answer the questions and then share it with each other. I think that's the much better way, in case you guys haven't done the questions already. Okay, now next question. Again, it's a question on shoulder dislocation. So 24-year-old rugby player was admitted to the ETU with a dislocated shoulder joint. What would be the most possible position of the head of the humerus of his dislocated shoulder? Okay, so now you can have anterior dislocations, you can have inferior dislocation, posterior dislocations, but they're asking for the most common type of dislocation, essentially. Position. Yeah, so that's what they're asking for. So what do you think is the most common type of dislocation? So Black Chair is asking, what if we didn't learn some topics? Right, so now I think it's a little bit too late to learn topics if you guys are starting on the 9th of September. It's never too late, but what I would say is go through the SEQs, prioritize that, and the MCQs. Because anyway, what the questions asked in SEQs are also the same questions that they will be asking for Viva. Okay, there is always an overlap, and what you'll be studying for SEQs will also be assessed in MCQs. So when you're studying for the SEQs, you're learning for everything. But what certain people do is they go through books like Ellis or Last Anatomy Now, learn the content, thinking that they'll be able to pass the exam, but just doing that. And don't get me wrong, some people do pass the exam that way, but most people end up failing because they don't know how to answer SEQs. They don't know the diagrams, they haven't spent time drawing diagrams. So the best way to pass second MB, whether it's anatomy, whether it's biochem, physiology, is by doing the SEQs and MCQs. By SEQs, you getting familiar with the style of questions that they ask, so you know what are the questions they get commonly asked, and you already formulate answers for those questions, so you're more familiar on how to answer the question during the exam itself, because obviously you have 30 minutes. Sometimes 30 minutes is not enough to answer those questions. Some of the questions you don't even have time to think, you just have to start writing and keep writing throughout. Some other questions you'll have some time to think, but most likely the chances are that you won't have the time to even think about formulating an answer. You should already have an answer ready to write down. Okay, so I would say that's the best way in case if you haven't studied some topics. Okay, but once you do SEQs, you realize what are the topics that are commonly asked and the ones that you should be spending more time on. Okay, so no one answered that question, but usually the inferior dislocation or anterior inferior dislocation is the most common. So here I would say anterior inferior dislocation is the most common type of dislocation. Now, if you think about the general anatomy of the shoulder joint, anteriorly we have the glenohumeral joint. Like we said earlier, we have 3 bands, superior, middle, inferior. But inferiorly, on the shoulder joint, we have no ligaments. We only have the capsule that is protecting the shoulder joint. So that's the easiest point of dislocation. But I wouldn't say inferior dislocation here, because I know from the marking schemes of these papers, what they're expecting is the anterior inferior dislocation. So that's what I would say, I would suggest you guys to write. Okay, so for how do we get answers for SEQs if we don't have any answers from YouTube videos? So I would say ChatGPT would be the best way for you to get answers if you don't have answers already. Okay, so like I said, you can try with study groups, help yourself, go through the book and try to find the answer, or just put all these questions on ChatGPT and will give you a really concise answer that you can use, or at least like a backbone structure that you can use, and then to that you can start adding more things from Last Anatomy and from Alice. Okay, so I would say that's the fastest way right now if you guys haven't done these questions beforehand. Okay, now explain the main factors that would prevent the dislocation of the shoulder joint. So this is the same question that we saw earlier. We need to talk about the bones, ligaments, the capsule. You literally just need to say that the capsule is strong, preventing dislocations of the shoulder joint, but at the same time it's lax to allow all the movements possible around the shoulder joint. And then you talk about the 4 muscles. So in this case, you can see there's no questions on the rotator cuff muscles. So they're expecting you to write about the 4 rotator cuff muscles: insertion, origin, and innervation. And then finally the accessory features, the glenoid labrum and the tendon of the long head of the biceps brachii. Okay, so it's quite a long answer, but at the end of the day, it's going to give you those 40 marks. There's no need to do diagrams in this question. So if you include those points, you'll get the full 40 marks for this question. Explain a procedure that can be used to reduce the dislocated shoulder. Now, we know that there are 2 procedures that you can use, but since they're saying explain a procedure, you'll have to write only one method. So we know that there is the Koch's method, and the other one is the Hippocratic method. So the one that you're most familiar with, I would say write down. So if it's the Koch's method, you need to say that you're going to flex the elbow and you're going to rotate the forearm outwards which helps basically to stretch the subscapularis muscle, so that helps to maintain the scapula adherent to the thorax, but also at the same time the humerus to the scapula. And then you're going to swing the head of the humerus, and by doing so, what happens? Essentially the humerus returns back into the capsule. So the head of the humerus will be relocated next to the next to the glenoid fossa of the scapula. That's the Koch's method. Otherwise, if you want to talk about the Hippocratic method, you're basically using your foot as a fulcrum in the axilla, and you're applying traction and adduction. So that basically will help to relocate the humerus back in place. I would say it would be best for you to talk about the Koch's method here, because it's a little bit more detailed rather than the Hippocratic method. So I don't know, if I was you, I would write the Koch's method rather than Hippocratic method, because there's a little bit more to talk about. So that in my mind, it gives me a little bit of peace of mind knowing that I've written a little bit more, so that will contribute for the 20 marks. What about bath knots? Bath knots are fine, so you can use bath knots. They are very detailed, actually, not gonna lie, they're very detailed knots. I haven't personally used them, I've seen them, but yeah, as a last minute resource, if you're in a really desperate position, okay, fine, bath knots would be a good source to use. Right, and then the last question for 30 marks, briefly explain the arterial supply of the shoulder joint. Now I have a diagram here. So again, this is asking about the axillary artery. Okay, this is said describe, briefly explain. So for this one, again, because this is something that you can describe easily with a diagram. I know it doesn't say describe, it says explain, but you can put down a diagram here as well for the axillary artery. Okay, so this is not a section where you have to talk about the parts, but you can easily break down the axillary artery again into the 3 parts, and then put down all the branches coming out, the superior thoracic artery, the thoracoacromial artery, and the 4 branches, okay, the subscapularis artery, and the most important ones that you need to include are these ones, the circumflex humeral arteries, anterior and posterior circumflex arteries. They go around the surgical neck of the humerus. So those are very important branches that you shouldn't forget to mention. Again, the order of the branches is very important for you to achieve the 30 marks. Obviously, remember that after the diagram, you'll have to write everything down. Okay, then moving on to the next question. A patient was found to be having a fracture in the midshaft of the humerus. Right, so right away, as soon as you hear that midshaft of the humerus, the only thing that I'm starting to think about right now is the radial nerve and the deep brachial artery. Okay, they are running through the radial groove. So the first question is, name 2 structures which can get damaged due to this. Okay, right, so those are the 2 subjects, so the 2 structures right there, the radial nerve and the deep brachial artery, or the deep brachial artery, or the profunda brachii artery. Okay, so you can use both terminologies here. If the patient develops a wrist drop, how would you explain that using your knowledge of anatomy? Now, okay, so now when we talk about wrist drop, so we are talking about the radial nerve damage. right? So you can start by saying that since the radial nerve is passing through the radial groove, the mid shaft of the humerus will damage the radial nerve, and we know that the radial nerve is responsible for the innervation of the extensor muscles of the forearm as well as the extensor muscles of the arm. It will lead to a wrist drop. Now here you can also talk about the muscles that will be affected by this, and you can start to annotate them if you want as a list. Not so much about the triceps. You can quickly mention the triceps. So most likely the lateral head of the triceps will be affected because the rest of the two other heads of the triceps will be supplied by just a little bit higher up from the mid shaft of the humerus, so most likely those will not be affected, but the lateral head is one that gets supplied a little bit further down the mid shaft of the humerus. And then the muscles of the forearm. So let me take a quick diagram. Okay, so you can mention all of these muscles here: brachioradialis, extensor carpi radialis longus brevis, the most important one, extensor digitorum. Okay, so if you don't remember most of the muscles, at least extensor digitorum is one that you need to write down. That's one of the most important ones: extensor digiti minimi, extensor carpi ulnaris, and the anconius, because you can see some of the muscles don't reach all the way. Okay, like the brachioradialis, extensor carpi radialis longus brevis, while the extensor digitorum is one that goes all the way to attach to the phalanges of the fingers. So that muscle is very important. So the moment the radial nerve is not supplying anymore any of these muscles, it means immediately that a wrist drop will happen. Okay, so those are things that you need to include in that answer. What else would you say? Okay, so you could also talk about the clinical features here. Now, when you get a wrist drop, what usually happens is that the person will find difficult to create a fist. Why? Because the flexor muscles will be contracting, and when they contract, they push the wrist, the hand, further down. So if you can try that for yourself as well. So if you recreate a wrist drop and you try to create a fist, you can see that's really hard, and you tend to see that your flexor muscles start to cramp. Okay, so it's very difficult to recreate that. So that's something that you can write down here, and you can say that there is unopposed action of the flexor muscles, which makes it difficult to create a fist. Okay, so that's an additional point that maybe you can write down here. Right. Okay. And I think, yeah, this is the last question I have for today. So this is a 50-year-old female. A 50-year-old female was admitted to the emergency department with acute pain and swelling in her left distal forearm after falling on outstretched hand. On examination, dinner fork deformity was observed. Now, in this question, they're giving you two clues. The first clue is that this person fell on an outstretched hand, and the other one is that on an X-ray, so basically it's an X-ray, when they talk about here on examination, a dinner fork deformity was observed. So usually they will only give you the first clue, which is that the lady or the patient has fallen on an outstretched hand. So that clue in itself should give you an idea of what this person is having. So this is going to be a Colles fracture. Now when it comes to the wrist, there are two fractures: Colles fracture and Smith's fractures. If you fall on an outstretched hand, it's going to be a Colles fracture. If you're falling on a flexed wrist, it's going to be a Smith's fracture. And whenever they say dinner fork deformity, it will always be a colles fracture. So you have to remember this link between outstretched hand, dinner fork deformity, and colles fracture. Okay, so let's have a look at colles fracture. Right, so you can see it here. Okay, so you can see the dinner fork deformity. Okay, so this is what you see on x-rays, and usually the culprit here is the radius. So this is the radius, this is the ulna. So you can see that there is a fracture at the distal end of the radius. It's completely displaced. Okay, so the question is asking, state the most probable diagnosis. So it's going to be a colles fracture. Name an investigation to confirm the diagnosis. Is going to be an x-ray of the wrist. Okay, and state the site of the fracture. So we've seen it's going to be at the distal end of the radius. So if you say just the radial bone, that might give you 5 marks. If you say the distal end of the radius, that will give you the full marks. Site of the fracture. Yeah, there's nothing else more that you can say there. So it has to be the distal end of the radius. That should give you the 15 marks. Describe the bony arrangement of the wrist. Now, for this one, I think it's not related to the question itself. So this is just a general question, which made me a little bit confused initially whether it was related to the question, but I think this is just a general question about the bony arrangement of the wrist. So then you need to know about the radius, the ulna, and the carpal bones. What are the carpal bones? Proximal line of the carpal bones. Okay. And does it say describe? Yeah, it says describe. So essentially you're supposed to draw this picture. Okay, this is not a common question that they ask again, but it can come. Okay, so since you already been given a question like that, you might as well make the diagram and remember it by heart on how to draw it. Okay, so we have the radius and we have the ulna, and you have to remember now these sort of diagrams need to be a little bit more detailed. So you need to show that you know your anatomy. So you can see here that the radius and the ulna connected together, right? Because this is the distal radio-ulnar joint. We have the proximal as well as the distal radio-ulnar joint. So this is, you need to show them that there is a joint here, and you can annotate that as well. I say here as well, distal radio-ulnar joint. Okay. And then you have to show the proximal, and you can show also the distal row, but at least the proximal row needs to be there. So you need to have the scaphoid, the lunate, the trichotrom, and the pisiform. Okay, the pisiform on top of the trichotrom, like that. They should be connected to the radius, because as you might remember, there is no connection between the ulna and the proximal row of carpal bones. Why? Because there is an accessory feature, which we call an intercalated disc. Okay, so it's a small fibrous disc that sits between the two bones, between the carpal bones and the ulna. So you can draw that one there and say that there is a small intercalated disc or a fibrous disc, and it's an accessory feature of the wrist joint. Okay, so that will give you accessory marks, because I know a lot of people don't know that and they won't draw that. Okay, so at least for the guys that are here now, since I've been mentioning this, you guys can annotate that. Okay, I guarantee you that will give you extra marks, because a lot of people are not going to be doing that. So at least for the people that do that, the examiner will be very impressed and will get at least a few extra marks for drawing that. Should we mention like anteroposterior x-ray or for investigations used? Yeah, actually Sorry, I forgot to mention that. Okay, so it's going to be an anterior posterior X-ray of the wrist joint. Right, so that's describe the bone arrangement for the wrist. So 30 marks. So again, if you know how to draw it, again, it's very easy, 30 marks. So for the people that don't know how to draw it, then obviously it can be a huge nightmare. Okay, so it can go either way. Describe the anatomical pathway of the median nerve and list the structures supplied by it. Okay, so this is where we're gonna go to my lecture note, which I think you guys should have already. So yeah, it should be there already in your group, so you can go through this. So this is all notes that I've taken from last anatomy. So I summarized all the notes here and gives you the pathway and the innervation, the branches and all the muscles that it innervates for each nerve. Okay, so you guys can go through this later on and you should know all of this information. Okay, let's go through the median nerve, since that's the question that's been asked. And as I said, describe. Yeah, it says describe. So again, what you can do for this question is to draw the brachial plexus. So you can draw the brachial plexus very easily. There's no need to annotate in this case because you're only talking about the median nerve. So in this case, what you can do, just draw the backbone of the brachial plexus, annotate C5, C6, C7, C8, T1, put roots, trunks, division cords, and the terminal nerves. Forget about the smaller branches, just focus on the terminal nerves. And then you can say this is the musculocutaneous, coming from the lateral and the medial we have the median nerve, from the posterior we have the radial nerve and the axillary. I know that in this diagram the axillary is almost shown as any other smaller branches in here, but remember the axillary is also a terminal branch, and the ulnar nerve that comes from the medial cord. Okay, and then we can focus on the median nerve itself, and that's where we're going to look at this. So the nerve leaves the axilla as a continuation from the lateral and the medial cord. It follows the brachial artery and the two brachial veins within the medial and intermuscular septum, and then at the elbow it's found medially to the brachial artery. So this is where you're showing your competence about the cubital fossa, and then it passes between the two heads of the pronator teres, and then basically deep to the flexor digitorum superficialis, and again then it re-emerges on the radial side of its tendons, lying deep to the palmaris longus tendon before entering the carpal tunnel. Okay, so I know it might be hard to remember. I don't know if you guys try to memorize everything by heart, but what I would say is, just to make things easier, remember words and then use those words to make sentences during the exam. So median nerve, so lateral and medial cord. It leaves the axilla, follows the brachial artery and brachial vein. Forget about the medial brachial intermuscular septum. At the elbow, within the cubital fossa, it's found medial to the brachial artery. And then in the forearm, the median nerve passing between the two heads of the pronator teres, that absolutely you need to remember. Okay, so you know that each nerve, once it crosses the arm to go into the forearm, they will pass through certain muscles, like the ulnar nerve through the flexor ulnaris, flexor carpi ulnaris, the median nerve through the pronator teres in this case. Okay, and it passes underneath flexor digitorum superficialis. So if you know those keywords, that's enough for you to know about the course of the pathway of the median nerve. And then list the structures supplied by it. So I would focus mainly at the cubital fossa and the forearm. So in the cubular fossa supplies the pronator teres, because obviously it passes through the two heads, palmaris longus, flexor carpi radialis, flexor digitorum superficialis. Within the forearm, it gives the anterior interosseous nerve, and then it supplies the following muscles within the flexor compartment of the arm. And then, does it say only for the muscles? Okay, so it doesn't specify whether it's muscular supply that they're talking about, sensory supply. So in this case, you have to make sure that you mention both. So at the hand, the median nerve gives a muscular recurrent branch. It supplies the thenar muscles, and the what is it called? If someone can help me here, what are the muscles involved in the hand? The 3 thenar muscles and the lumbricals. Okay, the first 2 lumbricals. Okay, and the palmocutaneous branch that supplies the skin over the thenar eminence, and also provides sensory supply for the first 3.5 fingers. Okay, so it's written over here. Palmodigital branch supplies the flexor skin of the radial 3.5 digits, the nail beds, and the dorsal skin of the distal and the middle phalanges of the digits. They don't expect all of this detail, okay, because it's an exam, you're under pressure, but the more you write, the more marks they give. If you mention some of the muscles involved in the cubular fossa, some of the forearm, and then again you mention about the hand, if you show that you have broken down your answer into 3 different aspects, obviously they'll give marks for the way you answer the question as well. Okay, so make sure that before you start answering the question, there's always a certain order that you're going to follow, because if you write it in a much more cleaner way, certain marks will always be allocated for that as well. Okay, not just for the answer itself. Okay, so that's what I had for today. So this was on the upper limb. We'll also do some for the other sections. Okay, so when I'm able to do it, I'm just gonna drop down a message in the group, and then you guys can join this way. And obviously, if you have any questions, just drop them into the WhatsApp group. Okay, any questions you guys want to ask before we finish for today? No? Nothing? Alright then, thank you guys for joining. I'll catch you guys on the next session. So I'll try to do one maybe this weekend, or definitely next week, and it's going to be on the thorax. Okay, thank you for joining.